want to know a bit about how I got here or anything?
Absolutely.
Okay, because my accent's going to be the first giveaway, right? So yes, I'm Australian, and I was headhunted here back in 1987 by Surgeon General Koop, and I was the chief epidemiologist in the Office on Smoking and Health in Washington DC, and I moved here in 1990 and we established the cancer prevention program. We've been heavily involved in smoking for many years. One of the things I first noticed when I arrived, that Joe Camel had just started off, and you know, in Australia we had physicians who would go out and deface billboards with advertising, because they said, you know, it's an anathema to my profession that these companies can just addict the young kids, or can motivate them to start smoking before they're 18. And so whenever they saw it, they wanted to change something. And so there was the big Camel sign, breaking through the pyramid, 75 years and still smoking. And so I said, well, you know, what we would have said is he's addicted, as opposed to allowing it to go and become the cool Camel, etc. And so we started a look at industry marketing to see what it was doing. And we're able to very clearly show that the Joe Camel in particular was focused on young people, 12 and under, really. They were interested in starting to smoke later. They didn't necessarily start to smoke early, but they smoked at 12, 13, 14. But they were sort of attracted to it at 6 or 7. And so we started looking at their marketing and marketing practices for cigarettes. You know, the companies are focused on getting new smokers, and particularly people start smoking between the ages of 12 and 24 usually. If you make it through 24, it's unlikely you'll become a smoker. So they're particularly focused on 12 to 18, or they have been for a number of years. And they're marketing at those. And the other big market is the people trying to quit. And so all of the price discounting, lots of the advertising in stores, the advertising on the pack itself, that's aimed at making people procrastinate. The number of smokers say, I'm going to quit, but you know, just another pack, and oh, I got 3 for 1. I can't resist that, so etc. So their marketing is aimed at those two groups in particular in terms of doing that. You know, a number of countries now